So now we move to our next section of our conference, last half an hour, but definitely not least. This is great to have this opportunity to present new project, implemented project already in the final stages of implementation, maybe. That's a better way to say this. And I would like to ask my colleague and friend and member of America-Georgia Business Council, Winston Freeman managing partner, Karlo Goginava, to lead us to American Hospital in Georgia project and what were the defining sort of elements. I started with saying that this is a both interesting but also pleasant part of our conference because we are presenting new projects. It's in the final stages of implementation, practically implemented. So can you lead us with an idea of this project, sort of where we stand at this point, and why this is important for all of us?
Yes, with the great pleasure. So am I able to to share the screen? I think that's possible, right?
Yes, yes, please.
Okay. So do you see it?
Yes.
Exactly. So thank you so much. It was Mamuka again, once again, as always, a very interesting webinar today, and I'm thankful for this opportunity, first of all, to attend it, and then obviously to present some of our work, which is related to some of the activities mentioned by earlier speaker, Kenneth Angel from DFC, and once again, Kenneth, thank you so much for giving us this opportunity to be part of those wonderful stories. But talking about American Hospital Tbilisi, I would concentrate only on the drivers behind the project, on particular question, how did it start, why did we start it, and what was the role of Winston Freeman Capital while doing that. Couple of words about the company. So we are Winston Freeman Capital. This is privately owned financial advisory firm, impact driven, obviously, with 11-year track record of working with OPIC, DFC now. So we had the privilege and honor in 2010, which is good old times, OPIC times, to become a member of the so-called Enterprise Development Network, EDN. Which was PPP, public-private partnership, pursued by OPIC at that time. Our role was really originating interesting transactions to present it to OPIC, mainly small and medium enterprises, project finance. That is always something of particular interest for Georgian businesses, as well as I would say development finance institutions and OPIC and DFC in particular. So we serve pretty much the region with the headquarters in Tbilisi, Georgia, and with rep offices in Ukraine and Uzbekistan, Tashkent. So the sectors of experience, as you see on our account, some of the infrastructure projects, healthcare, education, hospitality, renewables in the pipeline. So that is a good overview on the sectoral coverage. Perhaps a few words on the achieved results. So we so far closed 9 projects with OPIC and DFC, both together, old OPIC and new DFC, with about 9 commitments in helping to secure 9 commitments with the overall financing over $300 million, and something which is in a pipeline we are working on is $400+ million, which is, from the original perspective for the company size like ours, is a lot. So selected projects accomplished with OPIC and DFC, where we acted as client advisors on the borrower side, obviously, you can see some of them mentioned already by Mr. Angel. Pace Terminal is one example. So we had the American Hospital already discussed. Some of other Georgian American University, Vendis in Georgia, Sheraton in Kiev, which is hotel project. So that is just cherry-picked projects to give you a sense on what is that we're trying to achieve here. Few numbers about American Hospital Tbilisi. That's the session that I was supposed to start presenting. Perhaps some to remind parameters, number of beds, American Hospital Tbilisi, number of beds, 183. The project cost, well, about $50 million. Building size, about 25,000 square meters, jobs created at stabilization 500 plus. You see the parameters of financing at that time, which is very important. I will explicitly then underline the role of OPIC at that time on how it accelerated, obviously, and you know, helped with the decision making on the investor side, standing behind the project. But here are the parameters, and talking about the DFC financing, about $18 million. So tenor went up to 14 years. Interest rate, I decided not to go into the details at this stage, but obviously that's some of the confidential information, but it was really loyal and friendly compared to any financing available on the market, talking about Georgia. So financing type project finance, and that is important because I'm pretty much sure that by the time OPIC's decision and committing to finance American Hospital Tbilisi, it was a first project ever, any development finance institution in Georgia jumping into the healthcare sector. And that is very important, and that was practically pioneering the sector for many of the DFIs in the country into the sector, talking about healthcare sector. But talking about perhaps something that I would like to start with, the main question, the drivers behind the project, I think all this can be summarized into three categories. First is the healthcare reform that was taking place in Georgia and still continuing, by the way. The second was universal health insurance program. That was an important element while considering the project from both investors and lenders' perspective, and outgoing medical tourism, which is an important element on why we pretty much back from, I don't know, 5-6 years ago, gathered, sat around the table and discussed the potential for American Hospital project in Tbilisi. Healthcare reform. In short and in a nutshell, reform really is all about allowing governmental spending, social spending, which was increased by the time, obviously starting early 2010, 11, 12. The governmental decision that allowed both public as well as private hospitals to benefit from the social spending. And it was an important decision because it really opened the door to many private players and obviously investors to look at the sector in general, because you see, just an example, bringing back 2013 numbers, the health expenditures grew by around 40%, jumping from 270 million to 390 million US dollars. And obviously that is interesting for the country like Georgia, because relatively small, obviously, and sectors like healthcare utilizing significant part of the budgetary spendings was certainly something of interest to the investors. It was one of the drivers, actually, that got potential investors of American Hospital Tbilisi to look into the case and become interested. Privatization process saw the better known as 100 new hospitals. It's also an important message. I remember we were discussing with the investors, with DFC and OPIC at that time, obviously, which allowed at that time the Ministry of Economy to go ahead with pretty much outdated facilities, public-owned, government-owned medical facilities, polyclinics, hospitals, to get privatized in exchange of the commitment and promise of the investor to use the land parcel in the center of the city, or as a matter of fact, Soviet-built hospitals and clinics, medical centers were built actually in the lucrative locations. So this privatization process allowed investors to go to get the land parcels, the buildings, to renovate them, reconstruct them, or begin the construction from the absolute scratch, and come up with the commitment to provide medical services within the new facility. So that's the healthcare reform in general. As a follow-up and logical consequence to the reform initiated in 2013, there was a decision of the government to offer universal healthcare coverage or insurance program that practically provided insurance to whole entire population of Georgia that were not covered by any private or corporate insurance, which gets you immediately practically 2 or 3 million, potential patients that would benefit from the basic package, paid by the government to whatever location the patient would choose to go in case of, in the case of insurance episodes. So that was important. And the key word here was obviously the formula that the money is following the patient. So the government provides the basic insurance, patients benefit from it, and once they get the episode and they go to one or the other public or private hospital, insurance is following them and government is paying for the services received. So this was an important program that practically, increased the annual government budget expenditures to about $650 million just in 4 years, 2012-2016. And this again was a very important incentive to investors to look at the projects like hospitals, because hospitals obviously is a long-term story in any part of the world. So investing into the hospitals, which is semi-social, semi-commercial story, is, as a matter of fact, a long-term journey. The third and the most important, perhaps at that time for us, or one of the most important factors to come up with the project like that and provide an incentive to both investor and lenders was the outgoing medical tourism. And for, as a matter of fact, for decades now, Georgia is tracking, in particular, not only Georgia, all regional countries, Armenia, Azerbaijan, we are recording high number of patients, or we were recording high number of patients traveling to Turkey mainly, some of the Eastern European countries, Israel, for high quality medical services. And just by the time we were dealing with the project, we had about 500,000, almost 500,000 of medical tourists visiting Turkey annually, with an average expenditures, to whatever you could think of, $3,000 to $5,000. And the key word here is that that's practically outbalancing medical, tourism expenditures, business that is going to another country and benefiting the healthcare system of, well-respected Turkey. With all due respect to them, all we wanted to do is to retain some of it, and perhaps create maybe a potential for Georgia to become a hub in some sense for delivering high quality medical services in Georgia for Armenians, Azeris, some of the Northern Caucasus countries, neighboring countries. And Georgia, with all due respect, historically has that attraction it was always a cultural hub, and we pretty much saw that becoming a medical hub is a very good story to start with. And again, as some of the speakers earlier said, let's put the goal first, and then let's better understand how we achieve that and what would be the strategy to achieve that. So, Mamuga, with this, I would summarize my part of the story and hand over the word to well-respected, distinguished colleagues. I think Greg is your turn now, right?
Yes, we'll ask Greg, who's a managing director at American Intercontinental Healthcare Group, and driving force behind this project, and among others, definitely, but pretty much bringing American expertise of healthcare management to Georgia. So, Greg, please, floor is yours.
Thanks, Mamuka. I'm very pleased and grateful for the opportunity to join this program. One of the things that I learned a long time ago is the last place you want to be on any agenda is either the last speaker before lunch or the first speaker after lunch. So for many of you, unfortunately, for me, I'm in Tbilisi right now, and it's 10 to 9. So lunch happened a long time ago, but for the stateside participants, I'm kind of like the barrier to your afternoon lunch. So I'll try to be brief, but very concise. As my dear friend Karlo, we refer to each other as brothers from other mothers, had said, this has been a project long in the making, but I think in many respects it's worth the wait, and I'll explain why. Part of the issue with healthcare in Georgia right now is you still have old facilities. You have, and I'll talk about this later in my program, a lot of vestiges of the Soviet healthcare model. It emphasized keeping patients in. It emphasized a lot of the concepts that really aren't current in healthcare thought. They really tend to exacerbate expenses rather than controlling expenses and getting better outcomes. American Hospital Tbilisi is fortunate enough to have the support of a lot of folks who see the benefit of bringing international standard healthcare to Georgia. I'll tell you a little bit about our mission, our vision, our values, and then we'll talk about facilities. Our mission, we're committed to leading with innovation and to contribute health and well-being in Georgia by delivering patient-centered, evidence-based healthcare reflecting international accreditation standards, and that will incorporate education, research, and practice. Part of that is, in any endeavor, you need to be sustainable, and part of our focus is to devote those resources and expand the resources that are necessary to make us as a sustainable healthcare resource to the country. Our vision, we want to provide an incomparable experience as the most trusted partner for healthcare. We want to ensure lifelong health and well-being for our patients. Additionally, we feel it's our mission as part of this to drive improvement and facilitate a rising of standards in Georgia. Many times in the past, and it's a continuing endeavor, the Ministry of Health, they want to embrace international healthcare standards and move toward a system where they are no longer the provider of care, they are the payer for care, and they can act more like a consumer, demanding the best quality they can for the patients that they're insuring. We're going to accomplish that through a number of different things. Our values include a focus on being patient-centered, a high focus on patient safety. One of the reasons that we hear from a lot of people for out-migration, in addition to the fact they can't get the particular service they want, is the fact that they're concerned about the safety factor. Are they safe? Are they really going to get the desired outcome they want? Quality. Our focus is on quality in everything we do. And this is exemplified in DFC's requirement. They incorporate it as a condition precedent to the financing that we must achieve JCI accreditation within a defined period after commencing operations. To me, that's a policy and a philosophy that we embrace. In all our facilities, We operate to a Joint Commission international standards. We don't deviate by country. The focus is on quality and outcome, reproducible outcome, and consistency in everything we do. We want to promote professionalism and teamwork, support knowledge and education. One of the issues that any hospital in any country faces is a continuing supply of a trained workforce. In healthcare especially, nurses make the largest single component of your workforce. In Georgia, we're somewhat challenged by the fact that nurses in Georgia do not enjoy the level of professional recognition that they enjoy in other countries throughout the world. Part of that is a vestige of the fact that their training levels are not comparable to other marketplaces in the world. For us to be sustainable, we need to support nursing education. A part of what we are entering into are collaborative relationships with post-secondary institutions in Tbilisi to support expansion of existing nursing education programs to bring nursing education up to an international standard. The selfish reason for us, if we have a nurse factory, it's a whole lot easier for us to maintain our level of service and maintain the level of our employment because we have an ongoing resource available for us to supply nurses. As it relates to internal operations, we treat everyone, our patients, our staff, our neighbors, our family members with respect and dignity. For us to be successful in the long term, we must abide by ethical standards. And I'll talk a little bit more later about some of the medical staff standards we're adopting, but our commitment is to ethics in everything we do. We also look to empower leadership and management. Part of what Kenneth alluded to in his comments this morning were that we look to facilitate a knowledge transfer. While my company is heavily involved in the management of this facility, I can't be here 24 hours a day, 7 days a week. For us to be successful, we need to be able to facilitate that knowledge transfer and the oversight of the processes and the policies that we embrace so that we can drive the improvement and the expansion of services. We look to continuously innovate, and we also want to inspire hope in everyone. There's hope for the future. It's very remarkable to hear the level of interest and support we are meeting or being met with by physicians in the Tbilisi community. They're attracted by the fact that this is a facility that will be operated at a standard, many of them having been trained outside of Georgia in their specialty, that this provides the level of facility comparable to what they trained in. They want to be able to maintain their skills. They want to be able to expand their service offerings, and they want to be able to do that in a facility that's comparable to where they learned. Let me tell you a little bit about looking at what we saw as the existing landscape. In Georgia, we saw fragments all across the board. The system itself there's no integration or vertical integration of services. That it's very smattered across the board. There was little, if any, emphasis on prevention. Many of the treatments involved pretty much a cookbook approach. This condition, this medication, we put as much in as possible. If one is good, two is better. So we go with two, we go for 3 weeks, and we just basically function on a cookbook. Clinicians over-investigated. There was a limited, prior to the expansion and introduction of universal healthcare, there were very few state-funded programs. Nobody invested in quality. Nobody invested in patient safety, and it was just a very haphazard system. Our business model and our operating model seeks to address each one of these factors, focusing on safety, quality, innovation, patient, family, and staff satisfaction, and cost effectiveness in everything we do. Some of the quality innovations that we're introducing focus on the physicians and the nursing staff. As we've said earlier, all our services will be operated in compliance with Joint Commission standards. We will have 100% paperless facility. We will be the first facility in Georgia that has an entirely paperless electronic medical record system. And that's not just the patient documentation, it's clinical results, it's imaging, it's on down the line. Any aspect of that patient's care never touches paper. And if there's anyone in this group who's ever had to convert an operation from paper to electronics, if you never have to do it, you can't begin to estimate how much time, effort, and headaches you've avoided. We've also introduced a couple of models for physicians to help grow and expand physician involvement and physician oversight in what we do. We will have a full physician clinical governance system, including a medical executive committee, individual physician committees for pharmacy therapeutics, for professional affairs, for credentials, for infection control, for physician peer review. This is something that doesn't exist in Georgia on an ongoing basis, where physicians privately evaluate was it the right thing to do for that patient. This is something that just doesn't happen in this country right now. And finally, we will be the only, we're already credentialing our physicians to a competency-based physician privileging and credentialing standard. This is where any physician who wants to practice at American Hospital Tbilisi must demonstrate their education, they must demonstrate their experience. And it's something that we have an obligation to go in and independently validate every aspect of that physician's training. It's not simply a matter of a doctor showing up and saying, I've got a license to practice in Georgia, let me practice. It doesn't work that way. We need to demonstrate to our patients and our medical staff that our medical staff themselves are competent and skilled and qualified to do the procedures, to do the kind of things they want to be able to do professionally. On the nursing standpoint, again, we're adopting international nursing care standards, really focusing on a patient-centered care model. Nurses establish their quality standards in conjunction with the medical staff. In addition to the facilities we have, we're also we've also developed and are fielding a nursing clinical education laboratory. Part of what we're doing with our nursing staff, we've had nurses on our staff since July of this year. We're very pleased that we're dedicating the facility tomorrow. To be quite honest with you, we're not going to probably see an inpatient in that facility until sometime in November. So in the meantime, our focus is on training these nurses up to a standard higher than what they've been consistently practicing at. And finally, a blame-free nursing culture. And what I mean by this is that we are not out to punish people who report deficiencies, who report quality matters. If we drive that underground, we will never have the opportunity to improve. We obviously you can't exist in a total error-prone culture, but by the same token, you create the environment where nursing staff can say, hey, I observed this situation. I contemplated this situation. We need to address it from a quality standpoint, how we overcome that so it doesn't happen again. Facilities that we offer are all literally state-of-the-art. A full service range of services is what you would find in a community level hospital. Our focus is primarily on surgical services, less emphasis on medical services. Our diagnostic services are what you'd find in any primary or secondary level of care anywhere in the world. Full range of imaging services, full range of diagnostic laboratory.
I think Greg had some probably connection problem, so we lost him. But we have Irakli Gogokhia here representing.
Maybe Irakli could continue from the
yeah.
slide. Yeah.
Yeah, or just, you know, I think we are running out of time. So if we could just summarize, maybe it was definitely interesting to look at facilities. Unfortunately, we cannot look at facilities right now, but.
Thank you very much, first of all, for having me here. My name is Irakli.
Irakli, we cannot hear you well, so I don't know if others hear you. But.
I don't know. Can you hear me now?
A little better, but yeah.
Greg is back.
And just like that, I lost my connection.
Yes. Greg, if you could summarize so that we may lose you again and we are running out of time. So if you could summarize,
Hopefully.
but
Well,
show us facilities if you can.
Yes, no, that's my next step in the program. Inpatient units, inpatient beds are really focused on a level of amenity that's comparable to anything you'll find anywhere in the world.
Kenneth, you want to say a few words before Greg is posting this? You wanted maybe small intervention about this project.
Certainly. I think building on what how DSC came into this was a combination of the things that the opportunity that was brought forward by that Karlo mentioned with from Wings and Freeman, that of what the government had made the changes for the hospital or healthcare reforms, I should say, specifically then was the insurance reforms. And then the third would be the medical tourism, which is sort of along the lines of what Otar was talking about earlier, which is import substitution. So to be able to have a hospital so that Georgians did not have to leave the country to be able to travel overseas, let alone the opportunity in the future to be able to have people that would come to Georgia to be able to get health care. So that was the part that made us think that there was a viable project, and then looking at the financials, that seemed to bear it out, but it was the developmental aspects that I talked about. So this is the fact that we saw with the US ownership that this was the first time that there would be US management in the country, so there would be that transfer of knowledge. We saw it also as a demonstration effect, because it would bring the best practices and the operating standards to enhance the health care for all of Georgia. So something that can have a spillover effect that can benefit it. So this is, these developmental effects, the jobs, the capacity building, the surgical offerings, these were all things that were able to be done, and that's what led DFC to be able to take a risk on this project, because it was the first time that any IFI had made an investment in the healthcare sector. So, thank you.
Thanks, Kenneth. Definitely encouraging to see those objectives being met by sponsors and management. Greg, are you here? So these are the facilities. I don't know who posted.
So I believe I'm back online, Mamuka. Just to kind of give you a flavor. Yeah, what you see here is one of 4 surgical suites. We incorporate any number of international kind of innovations. For example, you'll notice these walls are all glass. It's a modular OR. From a sanitation standpoint, it's one of the best surfaces you can have for an interior finish. You see here where I'm circling my cursor, this is a patient data system. This is the access for the surgeon who would be at the table, can see every aspect of a patient medical record, as well as all the patient's clinical vitals happening during the surgical procedure. This is all integrated. As well, these pendants above the surgical field also provide direct video feed for educational use, either on site or off site. Theoretically, we could support robotic surgery that was actually operated somewhere else. Now, this whole industry is a long way away from that actually occurring, but the technology is headed that direction. From a surgical service standpoint, we are operating 5 centers of excellence: neurosurgery, orthopedic surgery, cardiovascular surgery, minimally invasive and specialty surgery, and supportive services to surround those. And for whatever reason, unfortunately, my screen is not advancing.
Okay, but we have a good idea now.
My colleague, Dr. Irakli Gogokhia, who is our chief medical officer, I've asked him to kind of present the viewpoint of a Georgian physician trained outside of Georgia, and why a facility is important for improvement in healthcare in Georgia, such as what we're providing in American Hospital Tbilisi. So, yes,
Greg, if you
with that, I'm going to turn it over to Dr. Irakli.
Sounds good, thank you. And if you could turn share screen off, that would be helpful so that you could see Irakli.
Thank you very much, first of all, to having me here. It's really interesting meeting for me. As Greg mentioned, I'm leading this hospital from medical point of view. So I came back from Israel 5 years ago. I was practicing my medicine after my med school 10 years in Israel, one of the leading hospital in the world, Sheba Medical Center, in anesthesia and intensive care department. I have experienced 15 years of the practice and 5 years for the management, and it's honor to be in the team of the American Hospital Tbilisi. So regarding the practice, I will touch the practice first. It's, we already mentioned this a bit mixed in Georgia. We have different the practical skills here. Some doctors are coming from Russia, some doctors are from European countries. We have some US doctors as well, and to to fit this mix, it's a bit difficult because the main problem is that to speak in different language. So that's why our recruitment strategy was different, and we recruited doctors from different countries. We have the cardiac surgery leader from Italy, which was practicing 20 years in Milano Heart Centrum. We have vascular surgeons from Germany. We have orthopedic surgeon from AKH Vienna. We have oncosurgeons from different European countries, and of course we are looking for also for international leadership. And we have leaders from European countries and also from US as well. So let's say we have neuroscience center already. Mr. Greg mentioned, and we have a leader of neuroscience from Jefferson University. He's a local guy, Georgian, who is practicing medicine in US already 40 years, and probably he is looking for come back, and he will lead he will design our system, because 40-year US experience, it's a great opportunity for us. So we have onco team from University of Munich, and our hepatobiliary surgery leader will come from Germany and will help us to set up the system, because the most risky services, the onco services in Georgia, we have a huge lack of knowledge, and we need the good specialists who will help us for image, for pathology results and surgical interventions as well. This is what's regarding regarding the practice. So this hospital also has side of business. I will talk that very briefly. This hospital has very good future about medical tourism, which was mentioned already. So now the COVID situation changed everything in the world, and it's comes more and more popular. We are calling now double stage medical tourism, which means doctor is coming from Germany, patient from Russia, and procedures happens in Tbilisi. And of course, with less price, and patient is happy, and doctor is happy also because he's paying less tax fee, and they are doing this procedure with good income as well. So what is our benefit from in terms of the Asian countries? We around us a lot of different rich countries, which also has huge lack of education and medical level, more than we have, and they are running from their country to have some medical services in Germany, Israel, and Turkey mostly. So we can catch a couple of the patient flow from there as well, and to attract them and to bring them and to treat, because now the first aim is that the beneficial point for them is that we don't have visa for these countries, and they can fly freely. And the maximum flight hour is 3.5 from let's say Kazakhstan. Even from Azerbaijan, it's 1.5 hour, and from Armenia is same. We can attract even the Ukraine. So how we are planning also to set up the system of education. They need to have some education as well, and we are planning to have some fellowship programs to attract the young doctors from our neighborhood, to bring them here and to create the very strong bridge between our hospital and their own hospitals. When they go back, of course, they will have our background and our backup if they have some difficult case, and they will still continue to collaborate with us. This is what's regarding medical tourism, and this is really important to bring foreign doctors here, because the people still have lack of trust for local doctors, and this can be a reason why they will stay here and they will pay this money for if doctor is coming from, let's say, from Germany or from US. Also, the government is spending around $13 million annually for outsourced services, which not exist in Georgia, and this like a blue ocean for us, and we have to set up the system here, and we will use this chance and opportunities as well. And other many things, we will be attractive after JCI for international studies and research, which extra money for country and for our hospital as well. And after, we can freely do some innovative treatments, which has high risk of the complication, because we will have some backup of the money to keep this level and standard, because as we mentioned already, one of the huge gap in Georgia is the low price, which low price source, which comes from government. And of course, I will not take more time. We will be, first of all, I'm a doctor, and I will guarantee here to every patient safety, quality, and the patient-centered care. And Greg already mentioned our aim and our goal, which really will be real in a few months later. And thank you very much again. I don't want to take more time. I know this time over already. And American Hospital will provide everything what we put on paper, and it will come real, definitely. And we will do for everything for that. Thank you very much.
Thank you, Irakli. Let's hope that we don't need doctors, but we know that we cannot live without help of doctors. So if we need them, we can place to go now in Tbilisi. I think I would like to now conclude. I think we are over time, and so I would like to conclude this first session of America-Georgia Business Council's 24th annual conference. One short sort of maybe summary sentence is that what I've heard today, obviously we've talked about some policy issues, some strategy, need for strategy, and directions about strategy. But I think what is encouraging for me personally is to hear about some of these investments and activities in Georgia that bring employment. We've heard about Rustavi's story. We've heard about DFC-driven projects, different projects, including American Hospital, which is creating significant quality employment in Georgia. We've heard about EPAM's activity and hundreds of jobs created in Georgia. So I think, again, there are challenges. There are many kind of obstacles we are facing on this road of economic recovery of Georgia and advancing economy of Georgia, building sustainable economic environment with a significant progress on employment side and so forth. There are challenges, but there are also signs of positive signs that we want to definitely encourage and advertise and support. So many thanks to all the speakers for this discussion about American Hospital, to Karlo, Greg, Irakli, and Kenneth Angel. Definitely many thanks, and to all the speakers of previous panels and discussions. And we'll probably come back to you with the date of next session, which will be dedicated to energy security of Georgia. We're planning to do it on November 11, and you'll hear from us about details of this event, of that event. So thank you again for everyone, and thanks to Irina, who is helping us with this organization of this webinar as well. So hope to see you soon all, and good luck. Good evening to Georgian friends and American friends in Georgia, and to everyone here. Have a great rest of the day. Thank you.
Thank you so much, all.
Thank you.
Wonderful day. Thank you.
Bye.
Thank you, Mamuka. Bye-bye.
Thank you, Mamuka.